Hi, my name is Intan Albiasari, and this is my pre-departure video for my radiotherapy clinical attachment. Before departure, I revised topics such as patient positioning and immobilization, and also inverse planning and advanced treatment planning. I also attended the clinical practice briefing to understand more about the clinical expectations. And mentally, I prepared myself to adapt to the hospital environment and try to speak or interact professionally with patients and also staff. My main goal is to apply my theoretical knowledge in real clinical settings. I decided to go to the hospital by using motorcycle because I think it's much more faster and helps me to avoid traffic jams. I also prepared things that I need to bring such as logbook, attendance book, pens, student card, iPad, power bank, and lastly, some candy to keep me energized throughout the day. Since I already started my clinical in emergency department of HKL, I expected things will be quite similar upon arrival. Once I arrive, I will report to the clinical instructor, join orientation session, and also familiarize with the department layout and safety areas. The Department of Radiotherapy and Oncology at Hospital Chancellor Tuanku Muhriz is organized under the leadership of Professor Datuk Dr. Rasman Jarmin as the director with the help of the Deputy Director for Clinical Services, which Dr. Zairul Azwan Muhammad Azman, and the head of department, which Professor Datuk Dr. Fuad Ismail. The department is divided into several sections, including Radiotherapy Planning and Treatment Unit and Oncology Daycare Unit, the Radiotherapy and Oncology Clinic, the Oncology Ward, and also they have nursing services and clinical support, which each of these is supported by various specialists and officers under their respective unit heads. There is also an administrative unit head to ensure the smooth operation and also coordination of all activities within the department. Overall, the organization ensures teamwork between oncologists, medical physicists, radiation therapists, nurses, and students in providing effective radiotherapy services. We were guided by clinical instructor, which is Dr. Muhammad Safwan Ahmad Fadzil, and also our supervisor, Madam Ainun Zubaidah Muhammad. The main equipment includes linear accelerator for external beam therapy, a CT simulator for treatment planning, and a mode room for patient immobilization. As a trainee, I expect to observe and assist in patient setup and treatment delivery. I also will learn about documentation, safety protocol, and teamwork with the radiotherapy team. I believe this attachment will help me to develop confidence and responsibility in a clinical settings. For future students and myself, I would advise to always being punctual, dressing neatly in the clinical uniform, and bring a small notebook or iPad to jot down daily learning points. Ethically, we must respect patient confidential and maintain professionalism at all times. In conclusion, I have prepared myself academically, mentally, and logistically for clinical attachment. I'm motivated to learn and contribute positive to the department. Thank you for listening to my presentation.